Okay, well, good morning. June webinar. I'll let Katie introduce our speaker. And again, if this will be posted on our YouTube channel, if anybody happens to miss our presentation today, spread the word. You can catch that on our YouTube channel. I'll put that in the chat in just a second. And then I'll send out also shortly, we already have our July webinar presenter set, so that'll come out pretty soon. So keep an eye out for that on your email from your VPs. And on that, I'll pass it over to Katie.
Hi, everyone. I am pleased to introduce Mike Nordos. He is our retail food specialist for our region with the FDA. He has worked in the retail food regulation for 28 years and has been with the FDA for the last 10. Earlier this year, I guess it was last year already, but I was standardized by Mike, and I learned some great tips for assessing person in charge duties. So I am hoping that you can take away that same information today and apply it to your everyday inspections. Mike, I'll turn it over to you now.
Thanks, Katie. Yep. So I am your retail food specialist. I cover states of Wisconsin and Iowa. What we're responsible for is standardization, working with the program standards and food code interpretations, amongst anything else we get assigned. So I'll just let everyone know that when I'm in presenter mode, both my screens get filled up here, so I can't see the chat. But I'll try and talk fast enough to have time at the end to answer some questions. Today,
I'll help you navigate through chat questions if they come up.
Perfect.
I'll keep an eye on that for you.
Thanks. Yeah, we can keep this informal because it looks like a fairly small group. And I just put this presentation together just for you. This isn't like an official FDA presentation. This is just something I put together because what we really need to do is start focusing on duties. We have active managerial control in the food code, and it's the best thing the best thing ever, in my opinion, to be put into the food code. It really can have a significant impact on public health in your community if you look at it. And the thing that we're finding out with risk factor studies, if you've done one and you're looking at things that are marked versus not marked, even if you just go through your data, it's one of the things that isn't marked very often, and it should be probably one of the most heavily marked things. And I think people don't like to mark duties because it feels personal. Because when you mark someone out for duties, you're saying you didn't do something right. And those are always the harder things to have a discussion with managers. So I'll get a little ahead of myself here and say some tips for doing that is it will show up as duties, but call it active managerial control because that's what it is. And talk about their policies and procedures in their establishment when you cite that. And if you do it that way, it makes it less personal. So you can say, look, we need to set up an active managerial control over this risk factor. You need some policies and procedures in place, some monitoring in place, some training in place, right? Those are the three things: procedures, monitoring, and training that go, I mean, there's lots that goes into active managerial control, but those are kind of three areas that you really have to have in order to have control over the risk factors. So if you tweak the discussion like that with the manager, it makes it less personal. It's still on him to develop, on the person in charge or her, but it's just a way, because I know that this is one that takes a little bit of practice and takes we can teach almost anyone the code, but diplomacy is a little bit harder. So take some practice on that. But without further ado, let's get into it. I just wanted to start out with a couple slides from the FDA risk factor study, because this is really going to drive home the importance of this. And I would like to see, I know that FDA is starting to move this way. We'll see what happens at CFP, but I would like this to be expanded, the duties section and the way we do inspections to be tweaked to focus more on some of these discussions on how they're achieving active managerial control on site versus just spot checking what we see today. Because I think we're going to have a bigger impact on controlling risk factors long term, and this study is the first step in evidence of that, because we need science and fact in order to move forward with things in the code that are different. So, and that's just my opinion, not official FDA opinion. I think that's where it will go. So what you're seeing here is the average primary data items that are out of compliance by food safety system category in our study. So what this means is if it says non-existent, that means they have no active managerial control. When we went in there and we asked about, for the risk factors, when we asked about their systems for how they control things, we found they hadn't even started to think about it. They don't have systems in place and developed. Underdeveloped means they said, well, yeah, you know, they have some systems, but we were able to find gaps in those systems. So they might have like take cooling logs of their main line, but nobody's monitoring, and if they miss them, nobody catches it, and there's no corrective action and things like that, right? Or maybe they do that, but they don't do it for the hot holding at all, right? So that would mean that they started to implement it, but they're not protecting public health fully because there's major gaps. Well developed means it's a system where we went in and it was complete and they communicated it to us verbally. They have a well-developed system that we couldn't find any gaps in, but they just communicated everything to us verbally. And then the next step up would be they actually provided documentation. Like they have the system, they have a training program, they showed it to us usually on a computer nowadays, but you know, all their employees come in and they get trained on what the cooking temperatures are, what their cooling procedures are, how, when and how to do hand washing, who's monitoring it, corrective, things like that. And it's all in a written program. And obviously those are more of our larger corporate firms that have developed things like that. So the key to this slide that I want you guys to take away with is for those establishments that we went in, and this is for fast food establishments. We break our risk factor study up into industry segments. So this is just fast food restaurants. So you go in, you place your order at a kiosk and you carry your own meal, that type of place. Anyway, so they averaged 4 out of the 10. So 4.5 out of 10 data items, which are the risk factors, out of compliance per inspection. Whereas those that were well developed and documented had only 2. So this should be a big aha moment for everyone. What this is telling you is that those places that have focused on active managerial control and developed their own systems had over half, or had less than half, the risk factors out of compliance than those that didn't. It's almost 3. So it's telling you that placing your time into talking about active managerial control is going to make a significant impact. Because if we can get these places to develop their own systems and policies and implement them, we're going to cut the amount of risk factors we see, which are directly related to foodborne illness. The CDC made that link years ago. Well, we know they cause it. I shouldn't say there's a direct link, but we know the things that are related to causing foodborne illness. So I better be careful because I know I have scientists on the call here, but we're going to impact them. So let's go real quick because I know I don't have a lot of time. This is full service. So same type story here, but what you're going to see is that the numbers are obviously a little higher. They're probably doing more of the cooling type things. So there's more opportunities for us to make observations. So we see more, but the results are the same. Over half. So just by implementing their own systems, they cut the risk factors in half. So when we come back out with such bold data out of a risk factor study, it really shows us where we need to act. So because of this, as Katie mentioned, we've had duties in the code, and duties is active managerial control. So that's where we've been spending a lot of the time, because Wisconsin is really ahead of the game. The inspectors are good. They've been well trained. They know how to go in and what they're looking at in the science and the code and everything. But what we're not looking at is duties for some reason. So what duties is, and again, you can find almost everything I'm going to talk about today, not explained quite as well, obviously, but in Annex 317. So don't forget about those annexes in the food code. So in the back of the code, it has explanations on why and the science behind everything, but also sometimes it will kind of give you guidance on how to assess and how to mark. So that's what we're going to be talking about for most of this presentation today, is how to assess duties. So what it tells you in the annex is, it just lays it out point blank, is that it's the responsibility of the person in charge to ensure compliance with the food code. That's what duties says. It says everything in this code is your responsibility to make sure it's in. Now, Having said that, in the annexes, it lists specific things, right? So that's where we have A through Q. We just added Q. So for those of you who have been standardized, last CFP, we added one more to this. But anyways, so what this is this is active managerial control. So we have a tool now that we can use on inspections to say, hey, this is your responsibility. You are or you aren't doing it, and to make an assessment on that. And if they aren't and they don't have active managerial control, it's out. It's a violation, and it's an important one to know that we have in our tool bag to write. So it is found under 2-103-11, which is duties, and again, it's A through Q. And I think I got the point that this is just what you are doing is you're assessing the level of active managerial control at the establishment. And the key, and this is the hard part to do, so I want to make sure I drive this point home. This is done independent of violation status, okay? You need to, yes, observations are made, but just because something is out, just because cold holding is out, doesn't mean duties are out, okay? Maybe they just had a bad day. Maybe they have a great policy and they're supposed to do monitoring. Maybe they are doing monitoring, but someone forgot or people make mistakes, right? So they could have a good system. So you need to ask questions about what their system is. And I'll show you how to do some of these questions in a little bit. But you need to ask and determine how they achieve active managerial control and what controls they have in place through questions with the person in charge and through when it says observations, it's like if they say they have temperature logs, well, you want to observe the temperature logs. Are they filled out or are they blank? Because if they're blank, there's a gap and they don't have active managerial control, right? So we'll go over that and we'll practice some of that today, but it's just keep in mind that this is independent of violation status because they can have something out but have a great system and they just made a mistake that day. Likewise, they could have all their temperatures in and they just got lucky. They might have no system at all. So there'll be times where you mark duties out for cooling. Let's say you go in there and you either didn't observe cooling or everything's in shallow pans, so it cooled right. But they aren't monitoring at all to ensure it, and they don't necessarily have a policy at all, and they couldn't communicate the critical limits to you at all that they need to meet for cooling. Well, they don't have active managerial control. They just got lucky, right? So you could actually have them in on a risk factor, but they don't have control over that risk factor because they don't have policies, and they would still be out in duty. So it's an independent evaluation. So, and it's all based on your interaction and observations with the person in charge and employees. And I explained a little bit how that works just a second ago. And just keep in mind that it's an overall evaluation of their system. So you're not looking for if they made a mistake or didn't do one thing that day. It's do they have a system in place and have they thought about it and have they implemented these controls, okay? My screen is reversed here. Usually the slide that's coming up next is little and off to the side. And for some reason, PowerPoint made an update. And now the one that's coming next is big in front of you. And the one you're talking about is little tiny off to the side. So it's kind of throwing me off a little bit here. So how do we assess duties? So what we want to do is we want to determine the system and level of controls that are put into place, like we just talked about. You're just seeing what they have for active managerial control. So you're going to do this through some discussions with the person in charge and then verify it through observation. So again, I touched on this briefly a second ago, but I want to clarify a little bit more now what I meant by that. So what this means is it doesn't necessarily mean that you're verifying through you found cold holding out and they said it was in and they have the system. That's not what we mean. What we mean is if they say they have a system in place, verify that it's been implemented. So you're saying, oh, you said you have a cooling log. Let's see the cooling log. Is it filled out? Is there corrective actions in that cooling log? You said you had a policy for hand washing. Who monitors that and seeing how it's been implemented? So that's what you're doing. You're not saying, oh, so someone missed, you saw one guy not wash their hands. Obviously, you don't have a system. That doesn't necessarily mean it. So you're just kind of verifying that their system is actually being used when you're doing that. So hopefully that's clear. So let's talk about I'm going to go through I'm not going to go through all A through Q for time. I'm going to go through kind of the ones you'll see most often. And I think by the end, you'll have a good flavor for what we're doing. So hand washing is a more difficult one to do an assessment on. You're going to watch to see if employees are washing their hands, and maybe if management sees them or is monitoring, and that's going to be your observations. But really what you're going to be doing is you're going to start out by asking some questions, because it's independent of what you're actually observing by yourself or violations that you see. So I would just start out by saying, hey, what's your employee hand wash policy? Do you even have a policy? And you're going to want to have them say, oh yeah, well, we have a policy. Hopefully it's going to say, yeah, when they first get to work or before they're doing any duties, switching duties from non-food duties, anytime a glove change is required between touching raw or ready to eat, things like that. So you want to hear them tell you the policy or show you the policy, right? Then what you're going to say is, well, okay, great. You have a policy. How do your employees know your policy? There should be some type of communication to the employees. He might say, yeah, everyone on day one receives a training and they sign off, or we have a morning huddle and we cover it, once a month in our employee huddle, or every day. So whatever, how do you communicate what you know to your employees? And you might find some gaps here, and you don't necessarily even need to say, hey, you're out on duties when you find a gap. Maybe they just need to tune it up a little bit. So if they were to say, yeah, we have this employee hand wash policy, we go over it and you look at it and it's good and they all get it day one, but then they never get it again, you might say, hey, there's probably a little gap there because people forget. You should do it again in a huddle or do an update or whatever. So that's the kind of thing you want to look at with that. And then who's responsible for monitoring the employees? Because that's a big breakdown in some of this, is once they've had the training and they do it, who's monitoring it? Who's making sure they're wearing gloves, and who's making sure they're not working when they're ill, and who's making sure that they're washing their hands, and what do you do when it's not? Because especially for hand washing, that's one sometimes they don't think about. They give them the training and then they get busy and they forgot about it. So they need to think that part of active managerial control is actually having a manager or head cook or someone paying attention and being ready to make a correction if they see someone else miss an opportunity when they should have washed their hands. So that's a little tougher one. Let's talk about cooking. So I'm going to give you guys a scenario. And it says the person in charge describes procedures that include final cooking temperatures that do not meet requirements in the food code. However, that person in charge can provide a sound management structure for how and when cooking is done in the facility and who is responsible for following those procedures. You observe cooking temps are not taken or recorded while you're there, and you temp a few items and everything is in. So cooking on this inspection is in for the day. You saw a hamburger and it was cooked to 155 degrees. You saw chicken and it was 168. What do you guys think for duties? Given this information, are they in or out? And since I can't see you, either just give a shout out or let me know. Or put it in the chat and Brian can tell me what people are saying. All right, you guys still with me?
Oh, I got no answers yet. Oh, I got one that says out.
Okay. Oh, and they actually pop up here, so I can see them too. Thanks.
Oh, good.
Yeah, they pop up. They don't stay for very long. Got some question. Ask what their cooking policy is. Yep. Some people say in. How do they monitor? Yep. Okay, so here's what I would say. I think they are out in this scenario, and here's the reason why. So when the person in charge, so I can't write the scenario perfect here because it's only so much space on the slide, but yeah, what you're going to want to say is, hey, what do you guys, what's your procedure for cooking hamburgers, or what's your procedure for ensuring cooking temperatures of all your products? And when they tell you and say, and do you have critical limits in that procedure, right? Because we need to know that they know where the critical control point is and where the critical limit is, right? So he should be able to know that, yes, cooking is a critical control point, so we have critical limits, right? Do your cooks know those critical limits? How do they know those critical limits? So yes, you're going to ask some of those questions just to drill down on the meat of their policy. But given this scenario, I said he didn't know that. He didn't know what the minimum limits were. He said we have I can provide you with our management structure, meaning this is who cooks it, how they cook it. Maybe he even says they're supposed to take temperatures. He just didn't know what they were, but maybe someone else knows what they were, right? But the key is here, you're watching then. So this is the observation part. Now they're in because you took the temperature. So it's not a violation today because they cooked everything to temp, but they didn't take any temperatures. And then maybe you asked them, hey, do you have a thermometer? And they said, yeah. Well, do you ever use it? No, not really, whatever. So that's the observation part, right? Is first of all, there were gaps in the system because there were no critical limits. So you're already thinking there's a gap here, duties are out, right? You got to make an improvement. But then even after he told you what the procedure was, that they're supposed to take a temp or whatever he said, you didn't see him do it. That's the observation piece. So when you put that together, you're thinking to yourself, there's a major gap in active managerial control. And that's the way that you should assess in or out. If you are assessing their control over the risk factor and there's a gap, so they don't have control over it, duties is out. That's an easy way to think about it, because what we're trying to get them to do here is implement a system that addresses those risk factors and the critical limits and controls the hazards. Okay, so let's keep doing a couple more here. We'll do as many as we have time for, and I'll just cut it short when we're done. Switch. There we go. All right. And we'll cut it short for questions because we can't get through all of them. So the scenario is the person in charge describes a cooling procedure that includes the critical limit. So he knows you have to get to 70 degrees in 2 hours, and then he knows you have an additional 4 to reach 41. However, he's unable to provide measurements or records of cooling, nor who is responsible for cooling in the procedures. So what this is he tells you everything that you need to know. However, they just throw the pans in the cooler before they leave at night. Whoever is the last person in does it. They don't monitor it. They don't keep records of it. They come in the morning and assume it's cool. You don't actually see anything to make observations. It's a Wednesday and they only do this Monday, so everything's already cool or used up or gone. What do you guys think for duties? Is he in or this person in or out? Got a few outs. Yep. Yep. All right. So the first scenario helped. So everyone gets it now. Exactly. This person is out. They know the critical limits, but they're missing a big gap here. There's absolutely no monitoring going on, right? So it doesn't matter if you know what to do if you're not making sure and ensuring that it's being done, right? And last year at CFP, or 2 years ago, there was the 2-inch cooling, and that was because of this. So maybe in the future this would be okay, because there's a CFP issue that says if as long as it's in a pan that's 2 inches or less, they don't need to monitor it. But that got shot down. It didn't go through. So they're still required, not required, but they are under duties to ensure that that's happening. So, yep, I would say they're out because you found a major gap. Hot and cold holding. So this is a good scenario because this is one people struggle with. So the person in charge is able to describe their cold and hot holding procedures, and they meet the code requirements. During the inspection, you find a few cold holding violations. Hot holding is not observed. It's not set up yet. You're there early in the morning, but it's first thing in the morning, and you have found that there's a couple coolers, top rails, where there's some things that are out of temperature, a little bit warm. They do have daily logs that are filled out. So they have logs for, they're supposed to take it at 9 o'clock every day. It's 10 o'clock, you're in there. They haven't filled out for the whole week. Whoever was supposed to do it that morning did not do it. So they just missed it. They're supposed to do it, but they didn't. So you have cooling out so far. What do you think about duties? That one person says in. Yep. All right, you guys get it. It's in. They have a system in place that doesn't have gaps. They're doing the monitoring. They're filling out their logs. They have good active managerial control. They just made a mistake, right? Things happen. Someone was supposed to take temps that day. They either didn't get around to it. Maybe they did it and they didn't record it. So perfect. So they're actually out on cold holding that day, but for active managerial control or duties, they were in. We'll skip sanitizing. Let's go to allergens. I want to talk about this real quick. So allergens is a new one. This is not a new one. It's 2008. But this is the only place in the food code where we talk about allergens. Because everyone's like, well, where do you mark allergens? Why does the FDA ask about that? It's under duties. So it would be marked out under O for duties. And what we, and it's actually it's not duties. It's under duties, but on your form, O is employee health. That's the confusing part. So this actually gets cited under employee health, but it's under O, cited as O for duties. If you're using the CFP form, I know maybe I shouldn't get into that because Wisconsin might mark slightly different. So anyways, so what this is saying is that the restaurant and retail operator needs to be aware of what the major allergens are, the seriousness of them, the symptoms and what an allergic reaction may look like, you know, and know that it could cause anaphylaxis or death. So that, again, they need to know those 9 allergens. And then they need to know or have a way of finding out what products they carry that have those allergens in them. Okay. So there's a lot that goes under allergens. And this is, I know, a gap where a lot of places haven't looked at it. And it might be because we don't focus on it a lot of times during inspections, but just let you know, allergens is in there, where it goes and the intent of it. And if you want to look at that a little bit more, you should read the annexes because it goes in a lot more detail on allergens and kind of how we're trying to assess if they have a system in place to protect people from having issues with their allergens. Employee health. Okay, this is different. Now, this does go under the duties. This is P. So when you're doing your employee health questions, you're saying, hey, do you know what the symptoms are? They should know vomiting, diarrhea. They should know sore throat with fever. They should know if you have a cut or infected cut or lesion or boil or something on your hand or arm, right? The part that goes with duties is they have to have communicated that to their employees. So this could be something as simple as they show you Form 1B. If all their employees have filled out Form 1B, then they've been notified of their responsibility to report to the person in charge, okay? So all this is this goes under duties because it's the duty of the person in charge to let their employees know their responsibility to report those symptoms and illnesses. Okay, so that's how it's broken down. Is this is all about communication. It's great. You have an employee illness policy. It covers you either do or you don't. It covers the illnesses. It covers reportable. It covers when they can come back to work. How do your employees know that? Have you communicated that to them? That's duties. Okay. This is the last one. I know I got only a couple minutes left here. This is brand new from last CFP, and this is just simply saying any written procedures. So I listed out the specific FDA code sections that require written procedures if they're doing such as time as control, for example. So if they have written procedures or plans that are required because they're doing one of these things in the code that requires it, then it's up to the person in charge to make sure that not only that they're developed, but they're maintained and keeping records and that they're doing it. So if they have a time of control procedure, but they're not using it, that's duties. They should be making sure their employees are doing that. So that was a lot real quick, but we only had a few minutes here. So I am going to see what you guys think. If you have any feedback or if you have any questions.
Mike, it's Katie. So I have a comment and then maybe 2 questions. The first comment, I just wanted to kind of share my experience when we did our standardization together. It was kind of crazy how many places we were marking duties out. So I just wanted to make that comment that we were marking it out almost at every facility because they didn't have, policies and procedures. They weren't monitoring it on a regular basis and just wasn't there. So I just wanted to kind of point it out that it might be a little underutilized on our inspection reports. My first question is, when you talk about policies and procedures, is it okay if these are all verbal, or does the FDA prefer that these should be written policies and procedures?
Yep, they do not have to be written per the code. So if they have policies and procedures in place and they can communicate those to you and they seem like they're good and they don't have gaps and they're doing them, they don't have to be written.
Okay. And then I have
In
a
fact,
second
and
question.
that gets a little harder with observations. So let's say they tell you they take temperatures, but they don't log it. I mean, technically you don't have to keep a log, right? So let's say they say, yep, we do cold holding every morning. This is the person who did it. They just finished. We actually don't keep logs. Well, they don't have to keep a log, right? So with cooling, that, in the scenario I gave you, they didn't even know who was cooling or who was in charge of it or who was supposed to do anything. And they just admitted they don't monitor. So that was a little different. Let's say they do monitor, but they don't write it down. I would make a recommendation they write it down, but there's nothing in the code saying they have to.
And then a quick follow-up question. I think all inspectors will agree that it's hard enough at like small retailers or mom and pop type places to get people to even follow the code. Do you have any advice for inspectors or these operators where they can go to get resources or how to encourage these smaller retailers on kind of getting these procedures and getting kind of these food systems in place?
I hope someone takes out a grant and helps us develop some of that, because what I didn't have time to talk about today or show you is that we do all kinds of stuff in our risk factor study. And what we found out is that somewhere around, I can't remember the number for sure, but above 20% is fairly high of chains have well-developed. So when I showed you those numbers of well-developed versus non-existent, only 3% of mom and pa's have well-developed food safety management systems. So it's not only showing what we should focus on, but who we need to focus on, right? So you are absolutely right. All these smaller places that don't have the resources that the larger chains do, they don't have this set up yet. So the answer to your question is, I would look at Food Shield and see what other jurisdictions have placed in some of the folders that could help you out with some of that. But no, we need to develop systems that can help these smaller places easily get up and running with some of their systems. But for the short term, it's getting them to implement it, right? So if they don't have control over cooling and they don't have active managerial control over cooling, that's where you're going to spend instead of just marking them out for the day and throwing food away, you'd be much better spending your time on your inspection saying, all right, you need active managerial control over cooling. Here are the critical limits, right? You need to get a thermometer, you need to put it in a shallow pan, and you need someone to monitor it. Once you do that, that's active managerial control. And if they can remember that and tell you that next time that that's what they're doing, they have it. Same with cold holding. If they're not taking any temperatures, it could be as simple as saying, look, you need to assign someone to take temperatures at this time and this time. That's your active managerial control. So it doesn't have to be a complicated system. You just need to get them to focus on the critical limits and monitoring it and who's going to do it, right?
All right, thanks. Yeah, I
So,
popped
yeah.
Food Shield in the chat if anyone wants to look that up too.
Yeah. So what Food Shield is once you're a member of Food Shield, you can request to become or to get access to the FDA resource page. And what that is that's a page, because what we talked about is people across the United States are developing great products, but nobody knows about them. And why do we need someone in Wisconsin that's a city to develop a product if someone in Texas did the same thing? So it's just a sharing site. So when people have products such as code in other languages, different types of logs or whatnot, they can put their product on there and share it with other people. So
We have a question from Laura. Laura, go ahead.
Hi, everyone. Can you hear me okay? I'm driving.
Yep.
Oh, you guys can hear me?
Yes, we can hear you.
Okay, sounds good. Good morning, everybody. Thanks, Mike, for the presentation. It was great. So this is might be more of a dad cat question, but also my question, and it's related to health space. So correct me if I'm wrong. Let's just say that the scenarios you just provided were in one facility, and there were 2 person in charge duties that were out. For marking purposes, though, that is, once it's out, right? The way health space is set up, there are like multiple outs that you can select. So sometimes there's 3 or 4 of them listed on a report. I just want to clarify that once that is out, it is out. So if it's, you know, they're not knowledgeable on cooling, or let's say maybe allergens, that they're just listed in that one single out of compliance narrative.
Yeah, Laura, I can address that. This is Katie. When we've been going over the new cloud system for health space, this was brought up because it kind of seems redundant or like double dipping if you're marking 4 or 5 duties out, and especially for like a jurisdiction that has a grading system, that's really bringing down a grade. So we have had a discussion with the health space team. It didn't seem like it was going to be easy for them to do that in the new system. So again, I think like our team might have to just start training people on maybe pick one, and then in the comments you add if there were other ones that were out. And Mike, correct me if I'm wrong on that, but I agree, Laura. I think it should just be like one. If it's out, it's out, not getting debited for 4 different violations.
Right, that's the intent. The intent is it's just the what is it, 210311. You just mark it out once, and then you would list, list what they need to focus on. And I would try not to overwhelm them. I maybe let them know which ones were out, but if they're all out, just have them take it by steps, right? So the key is to get it done. But yeah, we had that come up at one of our Wisconsin meetings where someone had received an extremely low score because they had been out. And I think the way you guys mark it, Katie, I don't remember health space for sure, but some of it, because it could go under different. So if there could be a scenario where you saw allergens, the allergens part was out, and that is under a different actual citation on your sheet, I believe. So there could be a situation where there's two. Because it goes under duties, and some of it goes under health.
Yeah, it's just how our reporting system is set up. Under duties, each one is individually marked. You'd have to mark them all individually. So it's not just like you mark duties out. You have to click on A, B, C, and then it gives you a violation for each one. So yeah, it's more of a training aspect on our end to train inspectors to mark it out just once, and then if there's multiple duties that are out, that they should be recorded in the comments or under that same violation, and not marking every letter, I guess. That makes sense.
That makes sense. Can you guys still hear me?
Yep.
Yes.
Yes.
Okay, and I have one more comment / question. Do you have any suggestions, just how to actually find the correct person in charge? There are a lot of workers in facilities that do very specific jobs, especially in restaurants, or do various jobs, maybe work part-time, maybe they're back from college. And I just want to make a comment that when you are assessing the knowledge of the person in charge, make sure it is the actual person that is in charge. And not just that, but from a industry standpoint, it is very helpful the more specific you are, and this is more related to report writing. If you're talking to an individual and they're not understanding, it's super helpful if that name is in the report, just the first name or the title of that person's position if you didn't catch their name. Because from a back end standpoint, it's easier for industry to go to that deli or to that that cook in the kitchen or whomever it is, even if it's the position. It's just easier for us to increase training and provide extra resources if there was an issue in the store or the restaurant. So that's more of just a request than a discussion, unless anyone wants to add to that. It's just very helpful to retrain and redirect on that standpoint. So that is all I have.
And that's a good point. So when we write the code, we can't write it to encompass every scenario. So we always try and train inspectors not to be black and white on the code, right? So the code says the person in charge. This is duties of the person in charge. Now, if you walk in and the person in charge doesn't know the critical limits, but the chef is actually the one in charge of the kitchen, he's not in charge of the restaurant, but he's in charge of the cooking and he knows the critical limits and when to temp and they're doing it, then they just be assessing active managerial control and don't get too much into that part of it. The code does say it has to be the person in charge. If they have control over the risk factors and they have a system in place, there's no correction needed, right? What would you write on the report? Oh, you have a great system, but the person in charge didn't know what it was. I guess you could write that, but it wouldn't accomplish anything. So the key is you want them to have developed their own systems in place where they know what the critical control points are and the limits are, and they're monitoring, right? Critical control point, critical limit, monitoring. If they've got that, then they're getting control over the risk factors. So that's our whole goal. So they're doing this all the time when you're not there, and that's what makes an impact on it. Is they're doing their own monitoring.
All right.
It's going to be a challenge. If everyone did this, they wouldn't need us.
Yeah, Michael, this is Craig from Pierce County. Can you hear me okay?
I can. How's it going?
Okay, it's going well. Thank you for asking. Active managerial control. Is this a nice way of saying have a HACCP plan without saying it? Because you're looking at all of your critical control points. So what I'm thinking of is when I go in to do a food safety inspection, I'm reviewing their SOPs, for example. And then I'm making sure they have all their logs to accompany those SOPs. Now, in your situation here, you're saying they don't need anything written. It can just be procedural. It can be oral direction. So that would be the only difference between, a written HACCP plan and a non-written HACCP plan. But essentially, we're looking for a HACCP plan, whether it's written or not.
No, I wouldn't go as far to that, because a HACCP plan needs to identify all the hazards within the processes and needs a HACCP.
Because you're looking
for but no. So a HACCP plan is required when you're doing something that's outside the controls. So they don't need to go as far as to identifying the hazards and knowing the hazards. They don't even have to know necessarily what or why they're controlling it, but they should know some of the limits, right? Because they don't if they're cooking hamburger, and hamburgers always get cooked way overcooked most of the time anyways, and they're just dunking it and they're just doing it for a certain amount of time, they can make mistakes, right? That's how like the Jack in the Box outbreak happened, because a lot of these places have a procedure. Like they dunk their chicken, they set the fryer has a certain temperature, they put it down, it goes down for 3 minutes, right? Well, yeah, that might be all that the one person has to know, right? So far they have a good procedure, but they should have some monitoring. Someone needs to know that, hey, we have to take a temperature every once in a while to make sure the system's working. So I wouldn't go as far to call it a HACCP plan. They would just need to know, hey, chicken needs to be, someone needs to know it needs to be 165 and we should temp it every once in a while.
Okay.
Yep. And it doesn't, I mean, maybe that is just the person in charge comes through once. If their policy is, hey, we're gonna set the grill temperature to a certain thing and there's a timer, that's fine. Then that's their active managerial control for cooking, but try and break their system and see if there's a gap in it somehow. In that case, I would say, well, someone should be monitoring, right? Because the code says you're supposed to have a thermometer and you're supposed to be able to take a temperature. So,
yeah. And I guess the way I view it, when I go to a school and they have a HACCP plan, well, we call it a HACCP plan, but I don't think it actually is. 'Cause I used to work in industry, so I see a HACCP plan a little bit different than, some might not, but, I don't see any of their chemical or their bacteriological written in the school's HACCP plans. So I'm thinking of it in the way the school format is set up in Wisconsin, not necessarily the way a HACCP plan would be set up from a industry standpoint. So.
Yes, no, it's kind of like process HACCP, like what we teach in 215, 218. Yep, everything we do at the FDA kind of it builds on each other and relates it. So yeah, we always teach the process HACCP, that there's control points for different processes. Yes, that's what you're monitoring. So it does. So a HACCP would have to be per each product, right? So they don't need to know that, but they do need to know. It doesn't matter what product we're cooling. There's cooling parameters, and and we know what they are, and we're able to ensure we're meeting those. That's what they need to know.
Yep.
Yep. So yeah, it's kind of a process hazard.
Okay. I'll think of it that way.
I'm not seeing any other questions, and at the same time, we've kind of reached our time limit here. Thank you again for presenting. This is a good one.
Yeah, no problem.
Thank you, Mike.
You bet. All right. Well, sorry we went over a lot of information to go over quickly. So.
No, it was terrific. Thank you very much. And for those still here, next month, July 10th, switching out of food quite a bit and hitting into childhood lead poisoning program.